Now to today's COVID report. We are reporting 726 new positive cases of COVID-19. That is the smallest Thursday we've had in at least a month. Kentuckians hospitalized are down 35, in the ICU up 3, on a ventilator down 38. Our positivity rate is up 0.07% to 2.92%, still below 3, and we have just 7 red counties. Today we are reporting 19 new deaths, and new deaths, remember, are the ones that come up from the local health departments as opposed to us identifying them through death certificates. Those include a 79-year-old woman from Barron County, and that's a January death. A 71-year-old man from Christian County, a February death. A 67-year-old woman from Clark County, February. A 67-year-old man from Davis County, February. An 88-year-old man from Fayette in February. A 61-year-old man from Gallatin, and a 75-year-old woman from Greenup, both in February. 77-year-old woman from Jackson. A 46-year-old woman from Jefferson. A 68-year-old woman from Jefferson. Those are all March. 88-year-old woman and a 95-year-old man from Jefferson, both February. Kenton County, a 60-year-old man, February. 62-year-old man, March. 90-year-old woman in Marshall County, February. 78-year-old woman in Montgomery, February. 79-year-old man in Taylor, February. 76-year-old man from Washington County, December, and an 84-year-old woman from Woodford County in February. Today, we also have 88 deaths that we are adding from our audit. Now, this pushes us beyond the original 604 we announced because we are being proactive. These are cases that have not come up from the local health departments, I believe, because they're still missing documentation, and they were missing documentation that would be needed to qualify them as a COVID death when we pulled the death certificate and looked at that information. These are ones that are going through our committee process. We're just doing it a little bit faster than it would come up from the local health departments. This will offset ones that we will learn about in the future. So what I think we'll see is, as we're doing this process, more on the front end and a lot less on the back end. For instance, there have been since we started the audit, we believe there's over 100 that came up from the local health department, but we had already found them and reported them through the audit. This means we will get to a full picture of the devastation of this pandemic faster, and we will make sure that there are no unknown losses, that there are no unknown soldiers, and that everybody is counted. Now let me show you best news of the day. Long-term care facilities. First time, and I don't know how long I've been able to say this to you, we have no new positive cases for residents in long-term care facilities. A year's been a long time, and I can't remember. I can't remember the last day when our update was 0 here. I think there may have been a day last week when we weren't doing an update, but just incredible. Only 4 new staff members, 3 new deaths when we go back and work the numbers, but these numbers continue to tick down. Proof, like Dr. Stack talked about, that the vaccines are working. They are our ticket out of this, and they are our ticket to protecting our seniors, being able to go see them in these centers. Really incredible. 0 new cases today in long-term care.